Japan's location in the major earthquake zones makes it particularly vulnerable to natural disasters.
March 11, 2011. A magnitude 9 earthquake occurred off the east coast of Japan, generating an up to 40-meter high tsunami that severely damaged coastal areas and resulted in more than 15,000 deaths and 2,500 missing people.
This is a catastrophic disaster.
As a consequence of the tsunami, the Fukushima Daiichi nuclear power station, located along the shoreline, lost its core cooling capacity, which caused severe damage to the reactor's core and led to a maximum level 7 nuclear accident on scale. Substantial amounts of radionuclides was released into the environment following explosions and discharge of cooling water into the ocean. In less than a day after the incident and the weeks followed, over 150,000 citizens within a 20 kilometers radius were forced to evacuate. Residents living in the vicinity of the plants were exposed externally to radiation from the radioactive cloud and ground deposits, and internally from inhalation and ingestion of radionuclides, including Iodine-131 and Caesium-137. Iodine-131 has a short radioactive half-life of 8 days and has particularly significant effects to children due to the size of the thyroid glands and the nature of the metabolism. Meanwhile, Caesium-137 has a half-life of 30 years, and this implies long-term risk of exposure for ingestion and exposure from ground deposition. Based on a large health survey of the residents and the dose assessments done by World Health Organization and United Nations Scientific Committee on the Effects of Atomic Radiation, the average lifetime effective doses for adults in the Fukushima prefecture are estimated to be around 10 millisievert or less, which is well within the annual radiation limit. As for the nuclear plant's cleanup workers, their average effective dose over the first 19 months after the accident was about 12 millisieverts. Among the 110,000 workers, about 38,000 received total doses of more than 10 millisieverts over that period, while 170 received doses of more than 100 millisieverts, which poses a slightly elevated risk of cancer. Outside Japan, a trace amount of radionuclides was detected in the air and water of California shortly after the accident. It is quickly dissipated and its effect was claimed to be negligible. This man-made disaster has significant public health consequences. The prompt response actions of evacuation has arguably led to a sharp increase in mortality among elderlies being placed in the temporary housings, deterioration of health in general due to the lack of access to healthcare, and also an increased risk of non-communicable diseases like diabetes and mental health illnesses. It's estimated that over 1,000 premature deaths has been caused by maintaining the evacuation beyond a prudent week or so. Disruption to the smooth operation of hospitals, the exacerbation of pre-existing health problems, and the general mental fatigue from the dramatic changes in life situation were the leading causes of these premature deaths. The displaced Fukushima population also suffer from psychosocial and mental health problems following relocation, ruptured social links of people who lost homes and employment, disconnected family ties and segmentation, a high occurrence of post-traumatic stress disorder, anxiety, and postpartum depression among evacuees was assessed as compared to the general population of Japan. Psychological problems such as hyperactivity, emotional symptoms, and conduct disorders have also been reported among evacuated children. There were no acute radiation injuries or deaths among the workers or the public due to the radiation exposure. For the 172 workers who received whole body effective doses estimated to be over 100 millisieverts, an increased risk of developing thyroid cancer and other thyroid disorders was estimated. Considering the level of estimated doses, the WHO health risk assessment stated that lifetime radiation-induced cancer risk other than thyroid are small and much smaller than lifetime baseline cancer risk. The greatest risk was found among girls exposed as infants. There were also reports about thyroid cancer cases being diagnosed among children exposed to low doses of radioactive iodine. Further analysis of epidemiological data will be necessary to evaluate a potential attribution of thyroid cancer to radiation exposure. In a global health perspective, the health risks directly related to radiation exposure are low in Japan and extremely low in neighboring countries and the rest of the world. Concerning food safety, radioactive iodine and cesium in concentrations above the Japanese regulatory limits were detected in some food commodities after the accident. WHO has worked closely with Food and Agriculture Organization through the International Food Safety Authorities Network to ensure that the global community receives the best advice on the matters related to the radioactive contamination in food. Since the early phase of the emergency, the Ministry of Health, Labor and Welfare of Japan, which informs the network about any residual radioactivity level in food, have monitored food contamination closely and implemented protective measures to prevent sale and distribution of contaminated food in Japan and outside of Japan. So far, the food that was sold, especially those exported, are considered safe to a large extent. Public health lessons learned from this unprecedented triple disasters are crucial to help Japan and all countries better plan, prepare, respond, and recover from potential nuclear accidents. Evacuation aims to minimize or prevent health risk of radiation exposure. However, the process of evacuation itself, especially under the condition of a severe natural disaster, may pose serious health risks, particularly for vulnerable populations such as the disabled, elderly, and children. Such relocation has resulted in the aforementioned health consequences of increased disaster-related deaths, psychosocial, and access to healthcare issues. Some therefore argue that a sustained evacuation may have caused more harm than allowing the residents to stay, given the relatively low radiation level and availability of iodine tablets. Thereby, authorities should take account of the negative health impacts of their response action in the case of future incidents. Worse still, disrupted infrastructure, disconnection of evacuees from the municipalities, reduced number of health workers, and failure of of local public health and medical systems due to relocation made it more difficult to address the deprived health of the displaced population. In hindsight, strengthening of public health services and improving access to healthcare are key issues for the well-being of evacuees. In addition to mental health, psychological, behavioral, and societal support, risk communication is also proved to be essential and should be carried out by trained specialists, while better education and training on health effects of radiation should be provided to the general healthcare workers. Now that 9 years have passed, so what still could be done? The Fukushima Health Management Survey is expected to contribute to future health effect assessments. Population health surveillance will permit the identification of additional needs for the delivery of healthcare. Moreover, as part of the occupational health programs, a special protocol for medical follow-up of emergency workers is being implemented. To date, the biggest challenge for the mitigation in Fukushima is the restoration of the social fabric and social trust. Hence, it is important for disaster reparations to include the elements of social empowerment to restore public faith and strengthen affected communities.
WHO Radiation Emergency Medical Preparedness and Assistance Network also continues to develop medical countermeasures against similarly impure emergencies, including providing a global network of biodosimetry laboratories.
Guidelines are now more clearly in place to ensure effective response by various parties. WHO partners with countries to ensure international radiation safety standards are kept. The Sentai framework also provides important guidelines for increasing disaster risk management capacity, of which WHO approved. Besides, international organizations like the IAEA also play a part in emergency response by following arrangements under the Joint Radiation Emergency Management Plan of the international organizations. As a take-home message, after the rain, Earth hardens. Efforts are needed both inside and outside Japan to share the public health lessons learned from Fukushima